Hey guys, Dr. Eric Smith, the Optimal Health Chiropractor, and today I'm here with Max, aka Conor McGregor. Kind of looks like that, if you would. So Max is a really good patient that I'm enjoying starting to work on. So he has a very interesting story. He's a construction worker that works outside, and in Wisconsin now it's like so cold outside that he still had to do that. But we were watching the fights actually, right?
Yeah.
Yeah, we were watching the fights and chatting, and you'd never been adjusted before?
Never.
Yeah, so unfortunately, this was a Dana White fail thing where it went down with one of the fights in Dubai. So we were chatting and said, "Hey man, let's get you adjusted." So we went over to where he had a table and got him adjusted. And then his biggest complaint is he had all this pain and like tension up there. And he's a strong dude, puts up a lot of crap working outside. You were in the military, right?
Yeah.
Military, so he's beat up his body quite a bit. And then so I was like, yeah, I want to help you out. So let's take a look, because he couldn't really. He had, what was it, falling asleep in both hands, or was it one hand?
Well, both hands, but it was mostly my right hand that just fell asleep in any position I was laying in.
Yeah, so in any position he was laying in. So normally that could be something coming out of the neck. So we did some stuff, and I did some orthopedic tests, just like we did an exam earlier, and it really seems like what's called thoracic outlet syndrome. So what that is that he sleeps on his arm, sleeps on his side, trying to get in that comfortable position. His head's more forward. He's working here. He does probably work with some stuff overhead, but with like a lot of us, we just get really tight through here. So all the nerves of the hand and the arm come through what's called your brachial plexus through this area and down and around, and I'm sure you've hit a couple of those nerves. So that's what was making him do that. And so you've had one adjustment, and then what do you feel now?
Well, since I work outside, it's been negative 20s, wind chill and all that. I actually don't wear gloves anymore, just from one adjustment.
Yeah, so now he's getting that blood flow back in there. The nerves are actually working. It's allowing his muscles to pump the way they should, so the blood flow and the fluids move. So cool. So I want to show you what we did with his adjustment. So the Conor McGregor thing came because his buddies said he not only like looks a lot like him, but when he gets going, that he acts a bit like wild and like that. So, but he's one of your favorite fighters too, right?
Oh, absolutely. My favorite.
Yeah.
It's taken me a couple weeks to get over it.
Yeah, right. So he's pretty tight through his lower back, and obviously he's using he has a weight belt that or a belt that he has to wear, the straps and all that's pushing them down his spine. So we're going to do some of that flexion distraction I usually like to do on a lot of patients that have the back issues going on through there.
This is fancy.
Yeah, so you're on a nicer table now. This is fancy. So this is going to stretch out your low back. We didn't get a chance to do this on the portable table that I was using before. But this is just going to stretch and open these joints up. Kind of those times that you wish that somebody could just stretch your back out, or you just felt like really compressed. Yeah. You should feel kind of like the joints open up a little bit, a little pressure when I put my hand in there. And so we're going back and forth now, and now we're going to go side to side. And this is usually a little bit harder with people, especially you have a little bit of a pelvic rotation going on, so I'm assuming it hurts a little bit more to go to one side than the other. But it's also one of those where your body's like, what the heck is going on? Yeah, so this is a great way to stretch the lower back and the musculature passively, so it means that you don't have to activate your muscles, you just get to sit there and relax. I have a lot of patients that are so sore through there, it's really hard for those muscles to relax, but you have to get those erector muscles to calm down, or else they're just going to continue to push those joints together and cause inflammation. So I'm just going to bring this back down now so we can get into your adjustment. We'll start off with some things with him, just kind of in the thoracics. His TL junction right through here, because he has to extend back, is pretty jammed up. So go ahead and take a nice deep breath for me. All the way out. Good. I think last time you were giggling quite a bit. Go ahead and drop those arms all the way aside. So up through here, I like to get these thoracics moving on people that are very head forward posture by doing a little bit different thing where I'm going to drop this headpiece down. Just let this relax for me. Oh. That was the one, I think. That was that right arm. So as he gets jammed up in there, getting these upper thoracics move is going to take a lot of pressure off his neck too. So we'll have you lay on your right side and face me, please.
Sure.
How'd that feel?
Oh, that was incredible.
Good. Pull your arm out like this. I'm going to drop this leg all the way off so we can get some more extension through your back.
Oh, goodness. I like farted.
Let's lay on the other side. It's happened a few times in my career, but not too much. And then same kind of thing. I'm just going to push you back a little more and get a lot more movement out of here. Good. On your back, please. Have you been able to sleep a little bit better now that your arm's not falling asleep?
Yeah. Yeah.
Anywhere but my face. Good. So still lots of tension up here, but that's pretty normal. So with him, he's kind of lost that natural curve of his neck, which is putting more pressure here. So the way that we adjust is by a certain way to start getting the joints to know that. So similar to like this, where I'm going to bring his head, let that relax. Good.
Oh, that's awesome.
There's the one. There's that one. So just a little extension right here. Good. Or traction, I mean. And then now that I pulled you down the table a little bit, I do want to get this area moving a little better. Let's have you slide down the table a little bit that way. You said your ankles were a little jacked up too, right?
Oh, yeah.
Yeah, so we'll take a look at those today too. And then a little chiropractic hug for me. Tuck your chin to your chest. Good. Did you ever hurt these ankles in the past?
Oh, yeah. I straight playing basketball.
Okay. You said your right one hurts more?
Yeah.
Your left one doesn't move as much. Let's take a look at this. Awesome. Good. Let's have you sit up and face that way.
All right.
Sit up nice and straight for me. Let's try to move those head around a big circle. How's that feel?
That feels good.
A lot looser?
Yeah, it's definitely looser.
How are the hands? Just nice and loose?
Yeah.
Good. So this is a type of treatment. Really getting this moving is going to help a lot with that thoracic outlet syndrome. A lot of people think it's carpal tunnel because they get a little numbness and tingling. I highly encourage you to see a chiropractor because it's probably not that, and it can save you a lot of time and money of not getting these nasty tests to check out for the carpal tunnel. So looking forward to adjusting Max in the future, and thank you for coming in today, and we'll see you next video.